Hi, my name is Linda Severson. The topic is demonstration presentation, and the general purpose is to inform. What is blood pressure and how is it measured? Monitoring blood pressure is an important, if not vital, part of the adult healthcare regime. Many of us need to have our blood pressures checked on a regular basis, and when this is the case, it's wise to use an electronic blood pressure monitoring device. I, however, will be demonstrating how to take a blood pressure measurement manually. Blood is pumped through the body through arteries and veins. The walls of the arteries are thicker, and this allows greater force to be exerted in pumping. The equipment needed in order to get an accurate blood pressure reading is a stethoscope and a blood pressure cuff. There are different size cuffs, so it's important to select the right size for the job. The sizes range from children's, that can also be used on a small frame or a frail adult, to thigh cuffs that are used on the thigh when it's not possible to use an arm. The thigh size can also be used to measure morbidly obese people. It's important to know not to use an arm that has an IV inserted in it, or an arm that may have the site for dialysis, or other types of shunts that are surgically implanted in an arm. Never use the same side that a mastectomy has been performed on. So first, I'm going to have my assistant come over. Now I'm going to show you how to take a blood pressure. First, you take the blood pressure cuff. I told you there's a gauge, and that's what you monitor as you listen. And you pump with a bulb type pump, and it has a valve. So you would apply the blood pressure cuff to the upper portion of the arm and secure it by the Velcro. Have the patient relax their arm. There's a place on the cuff itself that indicates where the artery is that we're going to be using. But you would take the first two fingers of your hand and palpate for the pulse, and when you feel it, then you insert the stethoscope earpieces into your ears. Take the diaphragm of the stethoscope, the listening portion, and you want to place it over the brachial artery. At this point, you want to take the bulb pump, tighten the valve, not too tight so that when you're ready to let the air out, that it's too tight for you to slowly release, and begin to pump up. You're going to want to watch the dial, and when it reaches about 180, stop pumping, release the valve very slowly, watch the dial as it falls, and the first beat you hear and the last beat you hear are what are recorded. Thank you. Now the first beat that you hear is called the systolic blood pressure. And what that is the pressure exerted when the heart is pumping. The second number you hear, or the last number that you hear, is called the diastolic pressure. And that's the pressure in the vessels when the heart is at rest. Now you would take the reading that you get from the dial. Say the first beat you hear is at 120. That would be your top number. The second number, or the last number, would be the diastolic, and that is the bottom number. Optimal blood pressure is considered to be less than 120 systolically and 60 to 70 diastolically. The American Heart Association considers less than 120/80 to be optimal, to be within a normal range. If a reading is greater than 140/80, this is considered to be high and should be evaluated by a healthcare provider. Should you want to repeat the blood pressure, wait 1 minute before repeating the steps. Remember, have your equipment, a stethoscope and a blood pressure cuff. Have the limb to be used free of clothing. Wrap the cuff around the upper part of the arm. Use the stethoscope to listen. Locate the brachial artery. Place the round part of the stethoscope over the artery pulse. Inflate the cuff by closing the valve and pumping the cuff up to about 180. And then slowly release the valve and listen for the first sound you hear as the pressure noted by the gauge begins to drop. This is the systolic pressure. Note the measurement on the gauge when you hear the last sound. This is the diastolic pressure. Place the first measurement over the last measurement, and this is your blood pressure. With practice, you'll be able to use your new skill anytime you need to take a blood pressure reading. A situation may arise where it's urgent to get a blood pressure reading, and you will be the one that can provide the assistance needed. Thank you.